Hello everyone, welcome to the channel. Today we'll discuss about an assaulted young man. Here is our MCQ. A 25-year-old man is admitted to the emergency department following an assault. You note a penetrating wound on the anterior chest wall. On examination, his blood pressure is 80/65, pulse is thready, and respiratory rate is 38 breaths per minute. His jugular venous pulse is unrecognizable as the neck veins are grossly distended. Breath sounds are equal bilaterally. During your evaluation, the patient's output becomes undetectable. So we asked about what is the most important next step of management. A. Immediate needle thoracocentesis. B. Plain chest radiograph. C. Pericardiocentesis. D. Resuscitative thoracotomy. E. Urgent echocardiogram. Now we will try to identify the main keywords in our MCQ. Here I have highlighted our main keywords. He is a 25-year-old man. He has admitted following an assault. So there's a penetrating wound on the anterior chest wall. Blood pressure is 80/65, which is hypertensive. Pulse is thready. Respiratory rate is 38, which is quite increased. And jugular venous pulse is unrecognizable. This is very important. Neck veins are grossly distended. Breath sounds are equal bilaterally. And during evaluation, output becomes undetectable. So these are the important keywords here. This is a classical case scenario. Here the patient is hypertensive and his pulse is thready and he has increased respiratory rate. And also JVP is unrecognizable and neck veins are distended. So after identifying these keywords, you can come to diagnosis and it's very straightforward. The diagnosis here is cardiac tamponade. So this patient is suffering from cardiac tamponade. When learning about cardiac tamponade, it's very important to remember this Beck's triad. It's low blood pressure, that means weak pulse or narrow pulse pressure, muffled heart sounds and raised JVP. So these are the 3 points in Beck's triad. Cardiac tamponade is a form of cardiogenic shock which is caused by fluid accumulation in the pericardial space. The fluid can be either blood or large pericardial effusion and it increases the pericardial pressure and inhibits venous return. So when the pericardial pressure is increased, it inhibits venous return and due to that cardiac output is reduced, and if you reduce cardiac output, hypertension is there and ultimately shock will result. So this is the pathophysiology here. Just keep in mind this part also. Now there are 2 methods to confirm the diagnosis of cardiac tamponade. First one is echocardiography and the second one is pericardiocentesis. Echocardiography in the form of a fast scan is less invasive but has a false negative rate of 10% even in experienced hands. So in this case scenario, the patient is getting deteriorated. That's why it's said as the urine output becomes undetectable. So in a case scenario like this, with a convincing history of penetrating chest injury, pericardiocentesis is both diagnostic and also therapeutic. And therefore, it should not be delayed by other diagnostic agents. Pericardiocentesis should be attempted first to allow time for a more controlled surgical management. Now back to our MCQ. Option A is immediate needle thoracocentesis. Here it's very important to identify the diagnosis. It's not a case scenario of pneumothorax which can deceive you. So this answer is excluded. Plain chest radiograph is important because we can see a large globular heart in a case scenario like this. But it's not the most important next step. So resuscitative thoracotomy may be required, but it is the reserve of surgeons experienced enough to perform such a procedure. Thoracotomy or pericardial window procedure should be reserved for cases where pericardiocentesis fails. So this answer is also excluded. Echocardiography is diagnostic, but in this case scenario, pericardiocentesis is both diagnostic and therapeutic as the patient is getting deteriorated. So pay your attention to this point also. Output becomes undetectable. So the best answer here is pericardiocentesis. So that's all about this MCQ. I hope you understood it. So please subscribe my YouTube channel for more important MCQ discussions like this. We'll meet from another question.